This past Tuesday was World Ovarian Cancer Day, a chance for women with ovarian cancer, their families and supporters to raise awareness about the disease. Dr. Thomas Herzog, Deputy Director of the University of Cincinnati Cancer Institute, and licensed clinical social worker Matthew Loscalzo from City of Hope Medical Center joined me to discuss. Good morning, gentlemen.
Good morning, Alex.
Hi, Alex.
Great to have you on. Dr. Herzog, let's start with you. So why was World Ovarian Cancer Day a good time to discuss family health history?
Well, Alex, I think any time is a good time to have this discussion because the topic's so important. We understand now that most cancers occur due to an accumulation of genetic mutations, and central among these genes that can cause these mutations leading to cancer is the BRCA gene. So the BRCA gene increases a woman's risk of developing breast cancer by age 70 to 70%. The risk of developing ovarian cancer is 40% by age 70 for someone, again, who carries the BRCA mutation. So you can see the importance of genetic knowledge of your genetic status, the BRCA status, and also the importance of genetic testing.
Certainly. So talk about the benefits of genetic testing and what that does to help prevent this and be aware of what your genes are saying.
Sure. So, Alex, I think it's important to understand there's really two forms of genetic testing. One, germline testing, where we try to understand what genetic mutations have been handed down from either the mother or the father. And we can perform that testing either with blood or saliva generally. There's also, in women who've developed, or anybody who's developed a cancer, we can do direct tumor testing, where we can actually look at the tumor itself to see if it's developed mutations outside of those that are actually inherited. The importance for ovarian cancer patients is it really changes the prognosis for the patient if we know they have a BRCA mutation. It actually improves it. But more importantly, it opens us up to new therapies that we can give now that we didn't have available before. And then the third thing is we can prevent cancers from forming in this patient that would be secondary cancer. So if she has ovarian cancer, we can start screening for and even doing risk reduction strategies for breast cancer. And most importantly, in my mind, is we can save a lot of other lives through testing the family. And that's why it's so important to understand genetic status, family history, and how that all comes together, because we can intervene medically and surgically to prevent cancers from developing in relatives who may have gotten this mutation from ever developing cancer in the first place.
Right. And Matthew, once families know that they have this risk in their genes, talk about the burden of knowing that and how to talk about it with their families.
Well, as you just heard, it's an incredibly exciting time. What was once science fiction is now science fact. But now families have got to integrate this complex information, as Dr. Herzog just talked about. The most important thing they can do is to communicate. And that doesn't mean a one-time conversation. That means over time processing the information that they have, and that primary place where they get that information should be from their treating doctor. And Dr. Herzog really in a moment can share some of the places that he feels best about. But really, ultimately, this is an anxious experience. It can be fearful, and for some people, there can be guilt. And that's why it's important to share what your experience is and to know what the next steps are.
Mm-hmm. Well, knowledge, certainly in this case and in many other cases, is power. It also is great responsibility. It can cause a lot of worries, as you say, but as long as you're armed with the right information, then you can tackle it. So before I let you go, where can people get more resources, more information to start this conversation?
Yeah, Alex, one of my favorite websites is bbrcaware.com. Lots of information on genetic testing and the implications of that testing. And as you said, we totally agree with knowledge is power in this case.
Excellent. Thank you both so much for spreading awareness about this and for joining me today. We'll be right back.